Good day everyone. Today in this lab we will discuss another most important biochemical test which is called coagulase test. This test is essential for identification and differentiation of Staphylococcus species, especially in the microbiology lab. And in the coagulase test we detect the ability of the microorganism to produce the enzyme coagulase, which convert the fibrinogen present in the plasma into the fibrin and lead to the clot formation. And this reaction will help to differentiate the pathogenic staphylococci from the non-pathogenic one. And as I explained in the previous lab about the catalase test used to differentiate between the staphylococci and streptococci. Now, another test used to differentiate between the staphylococci gram-positive species is called coagulase test. So we use this test to differentiate between the species of the staphylococci. So as I mentioned, the catalase test used to differentiate the genus, if it is staphylococci or streptococci. Then we use the coagulase test for identification the species of the staphylococci. So the aim of this test used to differentiate the species of the staphylococci. If it is Staphylococcus aureus, which is coagulase positive, it means they produce the coagulase enzyme from Staphylococcus epidermidis and Staphylococcus saprophytic, which is coagulase negative. It means they not produce the coagulase enzyme. This differentiation is clinically important because Staphylococcus aureus is usually pathogenic. The principle of this test depends on the ability of the coagulase enzyme to react with the plasma fibrinogen and converting into the fibrin, which is result in a visible clot formation. So the positive one, it leads to the clot formation, while the negative one, they are non-clot formation. Staphylococcus aureus produce two forms of the coagulase enzyme, two types. The first one is a bound coagulase, which is called clumping factor. It's a heat stable, it means that it's not destroyed by the heating, and this type of the enzyme it attacks to the bacterial cell wall and react directly with a fibrinogen present in plasma, and this reaction leads to the clot formation, and we can detect this type of the enzyme by a slide coagulating test. While the second type is a free coagulase enzyme, and it's a heat labile, it means it can destroy by the heat, and this type of the enzyme is secreted by the bacteria to the surround of the media and usually requires plasma factor, and which lead to the form of the complex. Then this complex convert the fibrinogen into the fibrin and produce the solid clot in the plasma. And this type of the enzyme we detect by the tube coagulating test. Now the procedure of the slide method. We mix the 1,2 colony of the bacteria with the equal amount of the plasma, and the result we will observe immediately after 2 minutes. The positive result is indicated by the visible white clump, which is indicate the positive result, while the non-clump it indicates the negative result. As I mentioned, this type of the coagulase, the bound coagulase, is present in the bacterial cell wall and react directly with a fibrinogen in the plasma, which is lead to the clot formation. After the slide method, if the result is negative, we should do the tube method to detect the free coagulase, because this type of the enzyme we can detect by the tube method. The procedure of this method it includes incubated 0.5 milliliter of the plasma with an 0.1 milliliter of the suspension of the bacteria and incubated at 37 cellulose. And we observe the result after 30 minutes up to 24 hours. Why we incubate? Because the free coagulase enzyme secreted by the bacteria to the surround media, and it's a heat labile, it means it destroyed by the heat. It required incubation at 37 cellulose, and we react with the plasma factor, lead to form a complex, then convert the fibrinogen into the fibrin if the bacteria is coagulase positive. So the positive result it indicated by the clot formation, while the negative result they are non-clot formation. Now the procedure of the coagulase test. As I mentioned, the first step in identification of the bacteria is always a gram stain, if the bacteria gram-positive or negative. If the bacteria is positive and cocci, we can differentiate between the two major gram-positive bacteria, cocci, staph and strep, by catalase test, as all species of the staphylococci produce the catalase enzyme. Now, if the result of the catalyst is positive, we can differentiate between the Staphylococcus species by the coagulase test. And the coagulase test, it includes two methods, slide method and tube method. The tube method for detection of free coagulase, while the slide method for the bound coagulase. Bound coagulase, it means it bound to the cell wall of the bacteria, and we can detect simply by the slide method. And the procedure is very simple. Put a drop of the plasma on a clean slide. Then we take the bacteria colony and mix with this drop of the plasma. And within just few seconds, 2 minutes, 1 minute maybe, the clump will be formed, which is indicate the positive result. If they are non-clump forming, it indicates the negative result. And you can see here the clump will be formed just in a few minutes, which is indicated by the white grains in a clean slide, which is indicate the positive result, as a Staph aureus produce the coagulase that confirm the fibrinogen into the fibrin. Another method of the coagulase enzyme, which is called the tube method for detection of the free coagulase. If the result of the slide method is negative, we should confirm by the tube method. And free coagulase, it means they are factor into the plasma that need to activation for confirming of the fibrinogen into the fibrin. And the tube method, the procedure, it includes put 0.5 of the plasma on a tube, then take the bacteria colony, 5 to 6 colony, and mix with the plasma and incubate it for 30 minutes up to 24 hours. After that, we observe the result. If the clot will be formed, it indicates the positive result. If they are non-clot, it indicates the negative result. Both of them is simple method, but the tube method, it required more time, while the slide method is very short time. And in this slide, we can observe the result of the slide method coagulating test. The positive result, it indicated by the visible white clumping, which indicates Staphylococcus aureus, while the negative result, they are no clumping. That means other species of the Staphylococcus, such as Staphylococcus epidermidis. As I mentioned, the positive result is indicated by the visible white clump in a slide method, which indicates Staphylococcus aureus, and the negative result, they are non-clumping. It indicates the other species of the Staphylococci, such as epidermidis and saprophytics. In a tube method, the clot formation, it indicates the positive result, which indicates Staphylococcus aureus, and non-clot formation, it indicates the negative result. It means Staph epidermidis or Staph saprophytics. And in the tube method, take the free coagulate and record incubation, while in the slide method, used to detect the bound coagulase or clumping factor because it reacts directly with a fibrinogen and lead to the clump formation, which is indicated by the visible white clump as a positive result. And in conclusion, the coagulase test is a rapid biochemical test used to identify Staphylococcus aureus and have a critical role in clinical diagnosis and infection control.